Hello, everyone. I'm Dr. Arefa Cassoobhoy. I'm an internal medicine doctor and the chief medical editor and vice president of medical affairs at Everyday Health. I'm here today with Dr. Patrice Harris, my colleague. She's a psychiatrist and the medical editor-in-chief at Everyday Health, as well as the past president at the American Medical Association. We're here today to celebrate the one-year anniversary of the Black Health Facts page on Everyday Health, which launched on Juneteenth, 2020. The mission was to raise awareness of the state of health for African Americans. The idea being that knowledge empowers, and that leads to improved healthcare and self-care. Patrice, tell me, how do you think this year's been?
Well, there is no question that it has been a very trying year in this global pandemic. But I would first like to say what an honor and privilege it is for me to be the medical editor-in-chief at Everyday Health, particularly at this time. COVID-19 has amplified, for many, these health inequities that exist in our country. But these health inequities are not new. And the reasons for these health inequities are not new. Structural determinants of health that lead to and influence the social determinants of health. But I can say at J2 Global and everydayhealth.com, doing is more important than saying. And I think this speaks to the importance of action. So we have the knowledge now about these health inequities. The question is, what are we going to do about it? And the Black Health Facts page at Everyday Health, I think, amplifies the issues regarding these health inequities and really health in general in the Black community. And I think it's a very important platform to influence and amplify that action.
I agree. I'm new as the chief medical editor at Everyday Health, and I have been so impressed by the authenticity of the page and the growth of the page and the development of the page over the past year, where along with the facts that have been included, there have been more facts added, and the resources and the storytelling that's been developed and connected with each fact is really important. The credibility of the content is so strong. I am proud to be here and really be a part of the further growth of this project.
Well, you know, credibility is important. We're seeing that as we talk to folks about vaccines for COVID-19. And you and I are part of a huge team that is really committed to being authentic so that we can be credible. Certainly, we want folks to believe and know that our content, our commitment is authentic, and that's a critical part of the future work.
I'm curious for you, where did you first really see those health inequities in action?
You know, I'm originally from West Virginia, not a very diverse state, a beautiful state, and I came to Atlanta to do my training in psychiatry, child and adolescent psychiatry at the Emory University School of Medicine. And during my internship year, I was able to spend 4 months in a pediatric rotation, and part of that was in the emergency department at Hughes Spalding. Now that emergency department served mostly communities of color. In fact, mostly African Americans, especially back in 1992.
I'm smiling because I was at Emory around the same time, working in the same hospitals, really being exposed to, for the first time, to the health inequities in how different people experience healthcare, particularly people of color.
We have that shared experience, and I bet we also have a shared experience of the asthma room.
Yes.
In the emergency department, there was a room, rows of chairs, where children came in if they were in respiratory distress due to their asthma. And so that was my introduction to row upon row of children in respiratory distress with the nebulizer mask on. And at the time, the focus is making sure that the children were able to get out of respiratory distress. But if we pull back the curtain a little, we should ask ourselves, why is it that these children were in the emergency department in respiratory distress? And so, although I didn't know it then, but I know it now and can appreciate now those social and structural determinants of health that led them to be there. The lack of access to preventive care, likely the lack of access to affordable medications
Yes.
that could treat their asthma at home, issues around transportation, and we cannot forget issues around the environment. In Atlanta during the Olympics, when most of us were out of our cars, admissions to emergency departments due to asthma dropped significantly. So again, the environment and all of these other issues, these social determinants of health, are critical factors when we think about health inequities.
It's really tough looking back on that time. And COVID really brought that to light about how much progress we've made, but how much more we need to make.
We have certainly made progress. I had the opportunity to talk to a pediatrician who continues to work in the Grady Emory system. And certainly there's been progress. There's no longer the asthma room, of course. Children are treated in individual rooms. So progress has been made, but no question, and COVID-19 has amplified that. We have a long way to go and a lot of work to do. And what an honor and privilege that we have to be on the Everyday Health team to do that work.